have you study for your NCLEX today. We are in the middle of our 30-day NCLEX challenge. Hi there, my name is Regina Callion, MSN RN, and I am here with Remar Review to help you get your nursing license. So we have been on this journey together to make sure that all of the themes in your virtual trainer, student workbook, and quick facts are taken note of, are mastered, are recognized, because the content in my virtual trainer is going to help you answer those NCLEX questions correctly. So if this is your first time joining us, welcome, come on in. We are studying and picking up where we left off, guys. What I realized during this 30-day challenge is this, right? So I printed out all of the calendars for the rest of the journey. So I have here the RN week 3 calendar. And then as I was printing out the calendars, I took a look at the PN calendar. And I noticed, of course, that the PN and the RN were different. So I had came to you on Monday with the PN calendar, and I had been working from the RN calendar. So we're going to get started with the RN review, and the PNs, you have this information too. It just may be in a different place. So make sure that if you're an RN, you're studying from the RN calendar. If you're a PN, you have the PN calendar. All right. So let's get started. Our major themes that you guys were supposed to go over today were clinical math. We had the easy NCLEX labs, electrolytes, diabetes insipidus, SIADH. And then we had a clinical judgment activity. Remember, content plus clinical thinking equals success. Monday, you were supposed to do the IV fluids. And I'm going over this because it may seem like a lot, but if you followed the calendar, you could have gotten through it. Pain management, TPN, substance abuse. All right. And then the quick facts quiz. So let's get started. I want answers on the screen. Share this video. This is our review. Day number 16. Let's go. Let's go. The first question is this, guys. In Meniere's disease, will we find it to be a chronic or an acute condition? What do you guys think? Meniere's disease, a chronic or acute condition? Put it on the screen. Hello, everybody. Come on in. We are studying. This is 30 days of NCLEX. I'm asking you right now, Meniere's disease, is it chronic or is it acute? Okay. Together, I want you to think about what you learned. You studied the content, right? You got your content today. This topic is in your VT workbook. You got your content. Let's press, give me chronic or acute. All right. I see a lot of chronics. I see a lot of acutes. Think, critically think. The correct answer. Hi there. If this is your first time, I'm happy you're here. The correct answer is chronic. Meniere's disease is a chronic condition. And remember, because the symptoms will get progressively worse. And it takes several treatment steps. Remember, we talked about the medications. We talked about eventually the surgery if the medications are not found to be helpful. So this is a chronic condition. Let me ask you this about Meniere's syndrome. Do you remember it? Okay, think about it. If a client has Meniere's syndrome, will reading bring on a Meniere's attack? Yes or no? What do you guys think? Okay. So can Meniere's syndrome be affected by reading? And I love this because I went over the program just like you guys would do. And while I'm doing it, I'm asking myself questions. I'm thinking about it. All right. Oh, think about it. Think about what's happening when you're reading. Think about what's happening when you're reading. Think about Meniere's syndrome. All right. This is the content. This is the critical thinking, guys, that we are trying to master. And I'm here with you along the journey. The correct answer is going to be, I'm looking at my notes down here, C. Yes. Great job. Reading is going to affect the client with Meniere's syndrome. All right. Because what are you doing? You're scanning a paper back and forth, right? You're scanning the paper. You're reading little lines, right? And And if you have Meniere's syndrome, this can cause the room to begin to spin. This can cause the room to begin to spin. So reading will affect your client with Meniere's syndrome. All right. Next question. Which electrolyte is directly related to Meniere's syndrome? Which electrolyte? The one that we talked about here. Come on, guys, answer quickly. Which electrolyte mostly affected by Meniere's syndrome? We got to go. We have a lot to cover today. All right. Let me see if I see it. Great job, Marie, Patty. Yes, Ajoba, I love it. Lorene, sodium played an integral role in many of our topics, many of our topics that we studied today. So I hope you picked up on how, even though, yes, we're talking about electrolytes, and sometimes we just think we got to remember the normal range. No, there is a reason why sodium is so important for the body. All right. Okay, I got to go on. Let me see here. Ooh. We studied this today. Which client would need a TDD in their room? Which type of client would need a TDD in their room? Keep on going. Put it on the screen. If you don't know, say, I don't know. I'm reading off my computer here, the notes that I wrote for you guys. Which type of client would need a TDD in their room? Come on in. This is 30 days of NCLEX where we just get together and we go over content and critical thinking. That's what we do here. We put them together. All right. I don't know. I love it. And another thing we do, we keep it real. Per the comments on the screen. So a TDD is a telephone device for the deaf. A telephone device for the deaf. And so when we were doing expected changes of aging, right, that came up a principle of clients losing their hearing, hard of hearing. All right. So I thought you might see that on NCLEX, and I wanted you to know. All right. I wanted you to know. Hey, Sean, I saw her at Walmart today. Oh my goodness. As I doing these lives, it is such a pleasure to meet real Remar nurses. And today I was in Walmart this morning and I met a Remar nurse. So you guys are amazing. I'm so proud of you. Every time I meet you guys, I'm here in Florida, and I'm telling you, I have never seen so many Remar nurses who recognize me. All right. And I'm wearing a mask. And so it just shows how the connection that we have when we study together. You guys definitely are my family, and I'm super proud of you. Shout out to all my Remar nurses out there. Sean, it was a pleasure meeting you this morning. All right. Next question. That was for the deaf. And I know I see the comments. I won't forget that. I won't forget it. Next question is this. In diabetes insipidus, is the urine concentrated or diluted? In diabetes insipidus, is the urine concentrated or diluted? Go. Put the answer on the screen. Smash that share button. I'm looking for the comments today. I want like 1,000 comments on this video. In diabetes insipidus, is the urine diluted or concentrated? Oh, really? Really? You put that answer down? You put that down? All right. Did you get this on the lecture? What did I say about diabetes? What do people sometimes call it? People sometimes call it water diabetes. So if it's called water diabetes, are there going to be a lot of solutes? Are there going to be a lot of particles in that urine? No. It's going to be very diluted because it's mostly water. Okay, it's not going to be concentrated. I fooled some of you guys. I'm glad we went over that because that is an assessment. That is assessment right there. All right, I'm moving on. Okay, in diabetes insipidus, critical think. In diabetes insipidus, if it's not treated, the patient will usually die of what? In diabetes insipidus, if it's not treated, the patient will usually die of what? This is a quick study session review. We are on day number 16 of our 30-day of NCLEX challenge, and we're following the VT study calendar. This is day number 3. This is week number 4. We are studying the VT calendar found in your file vault. You can print out each week and follow along with me. Yes, you can. Hey, you guys are absolutely right. In diabetes insipidus, if the client is not treated for it, they will die of dehydration. Dehydration is one of the major causes of concern and problematic conditions in diabetes insipidus. All right, good job, guys. Okay, next question. Which electrolyte is measured in SIADH? Which electrolyte is measured in SIADH? You guys know it. I know you do. I know. I have some people who are here that have been with me all the 16 days. And then I have some people who just joined me, and I am glad you are in the content. All right. I'm glad you are challenging yourself for this journey. We still have a lot to do, guys. We have a long way to go. So it's not too late to get started with this. The electrolyte that's measured in SIADH is sodium. It's sodium, all right? It's sodium again. Yes, that is a diagnostic criteria for SIADH. So you see how I put the themes together. Content, it's a process, all right? We were just talking about it with Meniere's syndrome. We follow how it works in congestive heart failure. We follow how it works in SIADH and diabetes insipidus, okay? There is a way that you can learn this information, and it doesn't have to be complicated, all right? Let me show you how to do that. Next question is this. In SIADH, will the urine be more concentrated or more dilute? In SIADH, will the urine be more concentrated or more dilute? Let's try this question. Think about it. Think about what we said the last answer was, and go ahead and put it on. All right. All right. Good job. Good job. Why? Why? Think to yourself, why? Why will that urine be more concentrated? The correct answer is concentrated. And the reason is because what? With SIADH, we have a lot of what hormone? You got to know these connections. We have a lot of ADH, right? We have that ADH hormone is telling the body to hold on to all the fluid. So the little fluid that comes out is going to be very, very concentrated because there's not going to be a lot of water in there. All right. And so this is the principles of the body that you might have missed in nursing school, and it's okay. A lot of us, we are not in nursing school. We are not prepared for NCLEX by nursing school. And so a lot of REMAR nurses had to take the initiative to get the program because they know they needed that review. All right. So with the SIADH, because the body is holding on to so much water, then their water retention results in concentrated urine. All right. Did you get that principle today? Don't miss it. Okay. All right. Okay. We went over math. Math was today. And that math information, whoo, I'm going to say this. I'm going to give you guys a critical thinking question. A critical thinking question, okay? If NCLEX gives you a ratio of 2-to-1 water to bleach, are you guys with me? If NCLEX gives you a ratio of 2-to-1 water to bleach, and NCLEX tells you that you need 2 gallons of water how much bleach do you use? Okay. How much bleach do you use? This medical math that we went over today. All right. Think about it. Critically think. If NCLEX gives you a ratio and they say 2 to 1, and they say you need 2 gallons of water, how much bleach do you use? Do you do one gallon? Is it 1 cup? What is it? All right, 2 to 1. What is the measurement of bleach? Okay. All right. Oh my goodness. I'm so proud of you guys today. You've really been doing really well. Really, honestly. All right. And what I'm reviewing is the NCLEX test plan. You guys know it's what I live by. All right. And I have covered the important math in this workbook. All right. Sometimes I go over the quick facts. Today is heavy. It's heavy this. All right. Good job. So if it's 2 to 1 and NCLEX says you're using 2 gallons of water, then you would use 1 gallon of bleach. Yes. So if NCLEX gives you options like gallons, cups, quarts, pints, you're going to keep the ratio measurements equal. All right. So most of you guys got that. Some of you didn't, but it's okay. That's why we come here. We come here to learn and learn from each other. All right. All right. Shout out Jamaica in the house. I love it there. I love Devin's house. I love Kingston, Jamaica, the ice cream. All right. Next question is this. Solutions. If you are ordered to give a solution, which route are you going to give it? Which route are you going to give it? All right. If you are ordered to give a solution, we went over medication administration, right? PNs. I'm pulling that from you guys. If you're ordered to give a solution, which route are you going to expect to give it? Oh, hey, come on, y'all. You guys got this. You can answer these questions. You can put your comments on the screen. All right. You can do this. This is your year to pass. This is your year to pass NCLEX. I know it's your year because you're showing up here. You could be anywhere, but you're here answering this question. If NCLEX says you're ordered to give a solution, which route are you going to expect to give it? Which route? All right. Yes, awesome job. The correct answer is going to be oral. All right. You would most expect to give solutions orally, by mouth, PO, oral. Good job. Okay, that's the most common. That's the most common form of solutions. All right. Good job, guys. Next question is this. Oh, this is it. Syringes are most often measured by milliliters or milligrams. Which one? Syringes are most often measured by what? Milliliters or milligrams. Okay. Good job. Come on in. Come on in. Get this good content. Get this good critical thinking. All right. You need both. This is my system. I am showing you guys VT quick facts. Do you have them? You have these two? Are you studying with me? VT plus quick facts. This is the 30-day challenge. I've never done anything like this before, but I'm so excited. It's day 16. I'm proud of myself. All right. Okay. The correct answer, milliliters. Of course, milliliters. You got it. Got them. I like it. Got them. All right. Milliliters. Okay. The syringe is going to measure milliliters, not milligrams. Not milligrams. Okay. All right. Shout out to you for trying. I'm happy you're trying. All right. Next question. Ooh, here we go. What does disulfiram treat? What does disulfiram treat? Bring it in. Bring it in. Come on in. All right. Hey, what does disulfiram treat? And I got this from, this came from substance abuse. All right, this came from substance abuse. Yay! All right. Disulfiram is used for alcoholism. Now, answer this question. Does disulfiram cure alcoholism? Does it cure alcoholism? That was one of the questions I asked myself as I was writing down the notes in substance abuse. Does disulfiram cure alcoholism? Okay. Again, yes, good job. The answer is no. Exactly. It does not cure it. What it does is it gives you an aversion. It's a medication used to give you an aversion to alcohol. Now, would you expect this medication to be prescribed at the beginning of treatment or at the end of treatment? If you think about alcoholism, if you think about it being a lifelong addiction, right? A lifelong hang up that you have to overcome. Are you going to give disulfiram at the beginning of the treatment or at the end of the treatment? All right. Think about it. Critically think. Take it to the next level. Are you going to give disulfiram at the beginning of treatment or at the end of treatment? I'm asking you these questions, guys, because you very well may see them on your NCLEX exam. I'm not coming here to play around and just ask you random questions. I'm here to make you think, okay? I am the mentor. I am your instructor. I am the virtual trainer in human form, all right? The correct answer is the beginning of your treatment, right? The beginning. We want to establish an aversion to alcohol at the very beginning. We want to change behavior. When you think about potty training somebody, right? You think about potty training a child. In the beginning is when you set the parameters. Like, okay, you have to go here. You can't do this. And so the disulfiram is going to help to change a habit. Does that make sense? All right. If you wait to the end, then the client is like, hey, what is this all of a sudden? I can, because they may have well still been drinking this whole time. You guys know. What else do we know about disulfiram? When you take it, you have to be mindful of what? Alcohol everywhere. And there are many things that have alcohol in them. All right. There are many things that have alcohol in them that the patient you don't want to come in contact with. All right. And so you guys know, like there's a lot of things. Mouthwash is one of them. So we got to be very careful. I gave you a list of them earlier. All right. Here we go. I got to go on. Oh, here's a good question. Disulfiram reactions, right? You guys know disulfiram reactions. If you have anything with alcohol in it, you're going to have a reaction, right? So there is an antibiotic that will cause the same kind of reaction. Does anybody know what it is? It is an antibiotic in the medication portion of your quick facts. All right. So as I was studying this, I said, I remember something from this that tie together. What is that medication? And it's one that we went over, that we had to go over on the calendar. All right. This is week number 3. We are in it to win it. I'm looking for that medication. It's an antibiotic that causes a disulfiram like reaction. Okay. That medication, somebody put it up there already, but I'm not going to say it because I see you guys putting things up there like penicillin. No. Doxycycline. No. Erythrocycline. No. The correct answer is why can't I say it? Help me. Metronidazole. There we go. Whew. That was a hard one. Put that up on the screen so I don't have to say that again. Pharmacology can be tough. Metronidazole. That's what it is. All right. And I don't want to see no brand names on here. I only want to see the generic names. Okay. All right. That's what I want to see. That's what we're studying. Good job. Thank you so much. Somebody says, just say Metro. If I just say Metro, would you guys know what I was talking about? maybe. Okay, next question. Which medication reverses the effects of narcotics? Which medication reverses the effects of narcotics? Okay. Come on in. This was a major point that you don't want to look over when you're studying the substance abuse lecture. You got to know it. Yes. Yes. Put it on the screen. You guys know it. Naloxone. Yes. Yes. Put it on the screen. Okay. So everybody got this one right. Not anyone got this one wrong. Awesome job. So remember, with this medication, what are the major teaching points about this medication for you as a nurse if you have to administer it? Number one, what it's going to do is it's going to bind to the opioid, right? It's going to get that opioid and absorb it. So if your patient has crashed, if their respirations are low, if they are unconscious, and you give this medication, right? If you give the medication, the patient is going to be revived. But a major point about this, and you need to share this video if you have a nursing student who's studying with you, because this quick review hits a lot of major topics. What's going to happen though is that the person very well may be revived for a short time, but go back under. Okay. And so it is very easy for the opioid to begin to overpower the naloxone. All right. So naloxone works very quickly, but it doesn't stay in the system a long time. So NCLEX likes to bring out that point. All right. Okay. And that just means that your patient will need frequent monitoring after you give this medication. All right. Good job. Good job. Yes. And you can repeat the dose, but look up the medication to know how often you can give it. Okay. All right. Good job. Okay. Next question. And we have been studying for almost 30 minutes. You guys know that I was given a 10-minute tops time frame for these videos. I never stick to it. All right. This is the last question, guys. All right. Where does the erythromycin ointment go in the newborn? Where does the erythromycin ointment go in the newborn? Go ahead, put the answers on the screen. Oh my goodness. You guys, not just in the eyes, I want the location. It's an erythromycin ointment, but there's a certain part of the eye that we need to put it in. And this is for all medications that we give in the eye. So I want you to understand this principle. Don't just tell me eye, because if NCLEX gives you a choice of the cornea and you put the cornea, you are going to get it wrong. All right. Because the cornea is very sensitive, and it is easy for nurses to cause blindness in patients because they just drop a medication in their eye. And I've seen it done so many times where I'm visiting a friend or a family member, or I'm working and I see a nurse. I've seen nurses just give eye medications, boop, boop, drop it in the eyes. And the cornea is so sensitive that it can cause blindness. The correct answer is the lower conjunctiva sac. Yes, that is where we put all eye medications for NCLEX. All of them go there. It's a very fundamental principle. I don't want you to miss it out. Okay, I don't want you to miss it. Woo, guys. Okay, we have went over the major things. All right, and not all of them, but we went over the ones that I pulled out for you today. Now, the goal of this entire challenge is for you to get in your virtual trainer and to stay consistent. Okay, showing up here. Don't miss a day. Even if you have to go back and watch 2-3 days at a time, this is the way that you set a good, strong foundation of when you're studying the virtual trainer, not just aimlessly studying it, all right? Going by the steps that I laid out, okay? Going by the steps that I laid out, all right? And if you are ahead of me, Perfect. Some of you guys are doing this virtual trainer in actually 30 days, which is possible. Some of you started the VT and you're like, I know you get 90 days, but I'm only taking 30. All right. And other you guys are, you're renewing the virtual trainer and you're picking up, you put it down, you got distracted, and now you're ready to recommit to the goal of passing NCLEX. So I'm proud of you no matter where you are. All right. Some of you are in nursing school and you're just watching this to prepare for your finals and you're going to get VT at another time. Perfect. But listen, this today now is the best time to get your license. All right. This is the best time to prioritize yourself. I met a Remar nurse today in Walmart and she told me she was a repeat test taker. She felt the first time with UWorld. The second time she did this. And a lot of you know what this is about. She only got quick facts. So she only studied quick facts, she said, and she failed again. So she failed a second time. Third time, went all in, got this book right here, got the virtual trainer and had the quick facts. And so on her third time down here in Miami, you guys know Florida, you only get 3 strikes. Okay. On her third attempt, she passed the NCLEX exam. What are you guys willing to do to get to where she is? Scrub down. I don't know if she was on her way to work or coming from work, but this is what it's about. All right. This is what it's about. It's about doing what you need to do and not giving up on yourself. Okay. This is a person who had not found success the first time, had not found success the second time, but said, I'm worth it. Okay. I'm worth it. Shout out future nurse Stewart. I am a senior nursing student who loves watching your videos. I graduate this year and I will pass my NCLEX. Ooh, awesome. Awesome. Never giving up is not an option. Never giving up. All right. So I'm going to leave you guys with this. I will be back tomorrow. And you know what? I'm not even mad at this, but if I look at the calendar, tomorrow is a rest day. All right. And you guys know on the rest days, we don't specifically look at a topic. We do questions and answers. So bring your questions. We can review it. And I will go over what I think is important for you to know on that day. All right. So I'll be back tomorrow. Guys, this is the 30 days of NCLEX challenge. People are asking, am I going to do it again? I don't know. There's so much. I don't think so. I don't know if I would ever commit to doing this again, but it's been fun and we're going to keep going. So don't miss the rest of the 30-day challenge. You guys know this. I'm going to leave you with this. You can, you will, and you must pass NCLEX. See you later, guys.
Hi guys, my name is Ashley and I recently just passed my NCLEX on the first try. It was all thanks to Remar Nursing. These books were so helpful to me. It had been a few years since I graduated from nursing school and I had not yet taken my NCLEX. I forgot a lot of things. This program was referred to me by a friend and I started studying, and Remar helped me realize my weaknesses so I could practice and study more. I'm just really grateful for the program. And I've been recently reading this book, which also comes with the set of books you get in the mail. And it just kind of helps you for starting out, and it's been very helpful. So thankful for the program. You guys should give it a try. Thanks.
The NCLEX Virtual Trainer is the best training system for nursing students who need to pass the exam. My name is Regina Callion, MSN RN, and I have helped thousands of nursing students pass the NCLEX exam with my program. You're gonna love it. With my NCLEX review, I'm going to give you all of my nursing content in one place. Not only that, I'm going to make sure that after every individual lesson, you know what is most important. And if you need questions to help you, I have the questions right here. So what I'm going to do is I'm going to give you an amazing opportunity to get in the virtual trainer. I'm also going to send you the virtual trainer student workbook as well as my quick facts for NCLEX. This is it. This is the opportunity that you've been waiting for. Click the link below. This is the #1 training system for nursing students who need to pass NCLEX. Don't miss out on this opportunity. Click the link below. Hey, what are you waiting for? I want to see you on the inside. This is the opportunity. You don't want to miss it. If your nursing license is important to you, you will take action right now. Let's click the link. Let's go.